Hello everyone, welcome back to Medical Coding Club. This is Chandrika. So today let's discuss a very important concept from musculoskeletal system for the year 2025. Okay, so these are the concept which are recently asked in CPC exam. So first I will give you the procedure overview, and later we'll get discuss the questions, real time questions, and also I'll try to solve very important questions which I have collected from the students end. So now the first procedure they have questioned is regarding secondary repair of extensor or flexor tendon in wrist. Okay, so both repair of extensor wrist tendon also there, flexor tendon is also there. So please go through this code range. So here the coding points are, you need to check what exact procedure they are doing. Are they doing extensor or flexor? And then you should also focus on whether they are doing primary procedure or secondary procedure. Okay, and in the code description you can also see like single tendon. Okay, so if you are seeing two tendons were repaired or tendon were the procedure is on two tendon, what you have to do, you have to give units to primary code itself, because we don't have any add-on code for this particular procedure code set. And next is injection of wrist joint. Here injection, aspiration, we have a concept. Okay, so you need to check firstly where they are injecting or where they are aspirating, from small joint or intermediate joint or major joint, you need to check. Okay, so small joint means finger and toes, and intermediate joint is like shoulder, major joints are like knee, and a few other things will come. So you can just go ahead and you can check for those code description and the example. And here the other thing is, ultrasound guidance is included or not included, you have to check. Okay, if ultrasound guidance is not used, then what kind of guidance they have utilized, you need to check. So if they have utilized CT guidance or fluoroscopy or MRI, you need to code radiology code for guidance as well. Okay, with the orthosynthesis or in injection code, you need to utilize the guidance code as well. Okay, only for ultrasound guidance you don't have to utilize any separate radiology code for guidance, because ultrasound guidance is included here. So please refer this code range as well. So on this topic there are two questions, so please go through this. And then vertebroplasty, here also like the spinal, what we have, the procedures like orthodesis, instrumentation procedure, decompression, and also fracture, compression, fracture. So please go through here the code range between 22510 to 22515. And next, revision of total disc orthoplasty. So here also disc orthoplasty, plasty is repair, so disc, the whatever the vertebral disc is there, they are doing a revision procedure. So on which location? On lumbar and plus lumbar plus circumlocation. So we have a specific coding guideline for L5 to S1. So please go through and understand what, like first you need to identify where they are performing the procedure. Okay, thoracic region or lumbar region or circum, you have to check. Next, incision and drainage of superficial hematoma of elbow. So for this elbow, the actual correct answer goes with the integumentary section, but options you will be able to see from 2 series also. So first you need to understand incision and drainage procedure thoroughly, and here superficial hematoma is there. So according to the correct coding guideline, you need to append integumentary codes. Okay, so refer this codes as well. So next, repair of deep laceration of hand with vessel suture. So here the correct answer we will be getting from 3 series, but options will be there from 2 series. Okay, so for that you can just refer this code range. And then orthodesis, here they have asked a question regarding posterior orthodesis. Okay, so when you are taking orthodesis procedure, you have to go through both posterior orthodesis and anterior orthodesis, and also After orthodesis, like if you take that hierarchy procedure, first decompression on spinal region, they'll first to perform decompression, and then orthodesis, and then spinal instrumentation, and then they'll do bone graft. Okay, so you need to check all of these key factors, and then you need to code it properly. Next, flexor tendon repair in wrist. So again, the question regarding flexor. So please go through this. And open femur shaft fracture repair with the debridement and rodding. So again, you have to check internal fixation they have did or not, and you can take the code. So also open versus closed fracture. So the treatment plan is important. Which kind of treatment they are doing? Open treatment means they will do incision. Closed treatment means they don't do any incision. And then percutaneous treatment means using screws. They'll utilize some instrument and then they'll work on that fracture. Okay, so you have to check that. And then with manipulation or without manipulation they are doing, that is also you need to check. Next, removal of deep facial tumor. This is like depth. Depth you need to check. They're excising tumor from subcutaneous level or from the muscle level. That you need to check, and you have to code the correct CPT code. So please go through this particular code range as well. And then so see here one more question regarding orthosynthesis only. So here they have asked a question regarding injection utilizing CT guidance. So then CT guidance is not included in our injection or aspirating codes from the series 20610 to 2611. So what you have to do for CT guidance, you need to additionally utilize CT guidance code. Next, laminectomy for lumbar decompression. So they are performing in the location of L2 to L4. So you need to check that interspace or segment, and accordingly find out the levels and code it appropriately. See here, identify single versus multiple level. Single level means only one level. Okay, one interspace will be involved. Multiple level means L1 to L2, L2 to L3, L3 to L4. That is multiple level. Next, electrode array and pulse generator. So here 6 series, as it's a combination concept, so you will be able to see this kind of merged concept. So please go through this particular concept as well. And then intercostal nerve block and rib fracture. So please check this: pain control, pain management. Trigger point injection. So here you need to check how many muscle being injected. Okay, so based on that you can take the code. If one or two muscle being injected, you will select 20552. If more than 3 muscle or 3 or more, then you will select 20553. Okay, and you don't have to worry about how many injections they are giving. You have to only count how many muscle being injected. Okay, that is a coding guideline for trigger point injections. So then we have all the questions here. Okay, important questions. So these questions, some 7 to 8 questions only I have added. Remaining I'll be discussing the classes and I'll be providing the material there. So tomorrow's session, like if I able to create a video, I'll definitely make this questionnaire explanation. Okay, so today, as I have took break from 4 to 5 days, I did not update any videos, so that's why I in quick I created this one. So I hope you have got a little insights on the important concepts of musculoskeletal system. Again, it is also for 6 marks. So whatever the concept I have showed now, those are very important. Okay, since you're already preparing for exam, I definitely you will be aware of all the basic fundamentals of those concepts. Okay, if you are not aware, then you need to you can join the CPC revision classes. So there I'll explain everything from basic. So that's all for today, and tomorrow I'll make time and I'll sit for a long time and I'll create the video of I'll explain all the questions from the second 20,000 series. Thank you for watching, and please do subscribe to my channel.